Hello, and welcome to the Lakeland Regional Health Trauma Awareness Day. My name is Danielle Drummond, and I am the CEO and President at Lakeland Regional Health. And it is an honor to have you join us today as we recognize our trauma survivors. We are so honored as an organization here in Polk County to be the area's only trauma center, caring for thousands of trauma patients each year. Our role in this community is essential, as we are one of the busiest emergency departments in the country, and we stand ready each and every day to be able to care for any patients that come through our door. And in this past year, where we've all had to face resiliency in our lives due to the impact of COVID-19, this should serve as a reminder of what our trauma patients face each and every day. They have set the bar high with their perseverance, and it is our honor to be able to celebrate them today. And none of this would be possible without the amazing care team that we have here, both at Lakeland Regional Health, as well as in our pre-hospital ground and air transport crews. Thank you so much for all that you do each and every day in caring for our patients and this entire community.
Trauma is not something that's done in isolation. It starts out from the paramedic or the firefighter at the field who will risk their lives to get through and actually get that person out of harm's way, even if the field's not cleared. And then they make their way into the emergency department. And we have the emergency department physician and the nurses there who are stationed, ready, when alerted, and prepared. There are times when you're in the trauma room and you see 8, 9, 10, 20 people all working. But the interesting thing is we work in concert. Everybody has a role, everybody complements each other. And the dedication that this group of people have is just phenomenal. That's why I would say I love working here and I'm proud to work here. I've got 9 surgeons that I work with, all full time, and we take call, we take care of patients, we take care of them in the emergency department, we operate on them, we take care of them in the intensive care unit and on the floor. So we're constantly rotating and we see our patients during different phases of their care. As a group of physicians and nurses working together, this team is very, very, very functional. We collaborate on patient care. We also are open to suggestions from each side of the aisle to say what exactly needs to be done. When we find issues that need to be addressed, we address them literally immediately. And we're always looking to get better so we can get better patient care for our community. So the care of the trauma patient, like I said, starts from the scene of the accident, from the injury, I shouldn't say, the scene of the injury, from where the paramedic, the firefighter gets that person to when they are in the emergency department. We take care of people there. We alert the operating room when needed or the interventional radiology department when needed, and we go there emergently. All these areas are people that are working, doing their own regular routine, and we pull them together to drop what they're doing so that we can take care of that patient who's in need emergently. And you know, this team of people are very good, and they collaborate and they communicate very well, and it is amazing to see how quickly they reroute so that we can get that patient taken care of. And so after that, we go to the intensive care unit if that's what's necessary, and that person has care in the ICU. You have 1-to-1 nursing or 1-to-2 or 2-to-1, depends on how sick they are, what their needs are. Again, it blows my mind when you see 5, 6, 7 nurses, floating around the patient when we do initial evaluation admission in the ICU, and they're all working together almost seamlessly. I mean, again, everybody has a role, they're complementary with each other. There's a lot of communication about what needs to be done and what's being done. In that time frame, once we stabilize the person, then we have the additional people that can and do come in. Sometimes we consult radiologists, we consult neurosurgeons for help that may be needed. We consult orthopedic surgeons, and again, over the years, just seeing these people drop what they're doing. Sometimes they're picking up their kids when you call them, and they've got to make arrangements for those kids and come on in. They just help the community as much as you can ask for. You get into the ICU, up on the floor, you've got respiratory therapists, you've got dietitians, you've got pharmacists. This is everybody. That old cliche about it takes a village, it takes a whole city of physicians, nurses, paramedics, respiratory therapists, you name it. Everybody's involved in the care of this person. And then on the floor, it doesn't change much. It's just now that they're on the floor, they're a little bit better. Things are less stressful. And as they start to recover, we have our physical therapists start working with them a little bit more, and then we start looking at what do they need. Now we have a phenomenal rehab facility here. It's called the Banach Institute. And right now, I put them up against anyone in the region. We've got 2 additional physiatrists, that's what they're called. The physicians that do physical medicine and rehabilitation. And that team is seeing consults, they're seeing patients on the floor, and they're coming in and they're actually giving us advice early, even before the rehab process is begun. So that entire set of individuals are also there, and they help to make sure that the patient gets as good a care as possible, so that we can get the best outcome for them. When it's all said and done, everybody puts the best foot forward in. We come in with our A game, and pretty much that's what you get every single day. It can be tiring, but it's very rewarding. It's rewarding because days like today, we get to see how people have recovered and how they've come back from what is a life-threatening, devastating event. And there are times that, unfortunately, we don't get everybody through it because the injury is just more than they could bear. But for those that we get through, it really, really rewards us, and we really get refreshed and re-energized to be able to come back and do it again.
My name is Larry Schlosser. This is my wife, Sharon. We've been together quite a while. The reason we're here today, I think, is just to talk to people, let people know what we went through, and what may come in the future for people who have gone through trauma. I was in October 6th, 2018. I was out volunteering with our community has a veterans organization, and what we've done for the last 15 years was pick up trash along the highway outside of our community. While I was out there picking up trash, a man in a Chevy Silverado truck was out of control and ran over me, and then I was left in the middle of the road, and he took off down the road. So luckily I was with a bunch of people that also picked up the trash, and they were right at it. They were ready right there, and they called 911 right there real fast. And so I had a little time, very little time, I guess, for the ambulance to show up.
And can I just say that the EMT was so alert that she, even though there wasn't a lot of blood coming from him, they told her what happened, and the other EMT, and she said, we need to get him immediately to Lakeland Regional, not Winter Haven, because that's where we were. So
once I got to Lakeland, the trauma center, I guess I can just thank God that there were people there, professional medical people that kind of knew what they were doing. Because if they didn't take care of me the way they did, I wouldn't be here today.
I had a delightful caregiver, Angel. He's not here anymore. He went on and got a higher degree and probably a much better job, but Angel took care of me 2 of the 3 journeys I had here. And the first time he walked into my room, he says, I know you, and I said, I know you. But then he said, he went and got his razor and his shampoo and cleaned me up, and when he came back, I said, Angel, you've got to tell housekeeping to clean this room because there's bugs crawling all over the walls. And he said, when your medicine wears off, the walls will clear up. So he was with me When I had my venous stents put in by Dr. Whitney, got 8 of them, and that was in 2016. What happened to you was in an instant, but your recovery is going to take a long time, and it's going to take a lot of patience, and it's going to take a lot of love and caring from your family and your caregivers, and it's important that you thank them for that.
After 6 weeks, I was brought out of a coma, and so I got to see firsthand what the medical staff was doing in the room. And they were, the word I use is rock stars. They were rock stars. They were just amazing. They were personally involved. They weren't just doing a job. They were personally involved, and I could see it on their faces. I couldn't talk, couldn't move at the time, so I could see. And at that time, it was still touch and go. I still wasn't out of the woods yet. My lungs were not working. I wasn't able to breathe without a ventilator. So I could see it in their faces, and I knew that, I may make it, I may not, but they were just doing everything they could to save my life.
Hi, my name is Melissa Bryan. I'm a nurse practitioner in neurosurgery. I work with Dr. Campanelli and have been so over the last 19 years. And I never tire of doing the trauma patients. I never tire of the challenge that you have in taking care of someone and then watching them go through such a roller coaster of events in their lives where their life is on edge, and then they come back and then they have a life that is sustainable, and you see the impact. And so when you know that going into it, you always have that hope that every person that you come in contact with will be that person that comes back in your office, and it's just so rewarding. And there's not a monetary amount that you can put on a life being changed, and it really means so much to the patients when they come back in, and someone who has had a spinal cord injury and they're starting to take steps, and all the months and months that every day that they're trying to wiggle their toe or trying to take a step, which is so rigorous when they're working through the pain of the injury. And then when they come into your office and they say, I want to show you what I can do. And when you see that, it truly is life-changing. And so I think that when caregivers see that over and over, I think that inspires you to want to give a stronger amount of effort in all that you do. And it really brings it down to where the rubber meets the road when your life is on the line like that. So many things in life that we think are important, but when you don't have your health or you don't have your strength, that really changes your whole perspective in life.
Hi, I'm Courtney Simmons. I work in the trauma ICU. I've been there for about 6 years now. What brings me joy working with our patients in that population is seeing them progress on a day-to-day basis and being able to help the families through the process and understanding what's to come next so that they're prepared and can be involved in everything that we're doing for them and the patient themselves.
The joy I get from my job is when I make someone that's really, really sick better. And we work as a team, and I think that we do a very good job here at what we do. I give all the glory to God first, because without Him, most of the things that we do, we wouldn't be able to. And I always tell my patients that it's more of Him and less of me. So, but that's the joy I get, and the also joy that I get is seeing the patients that we actually make better, have them come back so we can see how well that they're doing in their lives.
I'm Cora. I work in trauma ICU as a patient care assistant. I started in September 2019. However, in 2017, I had a family member that spent 2 months in TICU. So having both perspectives on family being there and seeing families and reconnecting is amazing.
And I think it's always really nice to see how the patients progress, but as a bedside nurse in the ICU, a lot of times they would leave me and they would still be really sick. So as a nurse practitioner, I get to see them up on the trauma floor, and they're there longer, and so you get to see their improvement over a longer period of time.
I love seeing how far that they've come. I love actually seeing the families too, because in some of the instances we deal more with the family than we get to with the patient due to certain circumstances, but it's amazing to see how far the patients come and how they've progressed and where they are and what they're doing now.
A lot of times our jobs at the bedside are very hard, and I think Trauma Day is a day where we can see what all of our hard work paid off, and you get to see the patient smiling and loving their family and not in bed in pain or struggling.
As a firefighter paramedic for Lakeland Fire Department, I assist Polk County Fire Rescue with patient care, sometimes arriving before them, with them, or after. We are a non-transport department, so we provide ALS and BLS care to the patient until the ambulance gets there, and then we work with Polk County Fire Rescue in getting that patient from the scene to the hospital. Sometimes we ride in with the crew on the ambulance if the patient is unstable or if it's a very high priority call.
Being a part of the Trauma Awareness Day is really important for us because we get to reconnect with our patients. Oftentimes, our trauma patients are not aware that we are there assisting them in the field. They're often unconscious in the worst condition. Two things happen when we visit them at the Trauma Awareness Day. They get to connect with the people that help them behind the scenes, and it humanizes us in the field as government workers who are first responders. On the other side of the coin, we get to help with our own mental and emotional health by seeing them on the other side of their traumatic injuries and seeing them with their families and with smiles on their faces and on the road to recovery versus concentrating for the rest of our careers on the ones that we lost along the way.
I was involved in a massive accident and changed my life forever. I was admitted to the hospital with many, many injuries, which included a broken wrist, 5 broken ribs, and a broken back in 2 places, a lacerated liver, a lacerated spleen. My right lung collapsed completely. My left lung collapsed 1 lobe. The sac that surrounds the lung was totally just a mess, is what Dr. Gogler told me. And yet here I am today. And this is, how it happened is that God immediately saved me and gave me a vision. When I looked at my hands, I thought I was bleeding terribly, and I was, but it was a vision. I was bleeding inside, not outside. And that gave me the knowledge, tell this person I was on warfarin, that came to the window as soon as I looked at my hands. These things don't just happen like that. And from that point forward, I don't remember too much. I was rushed to the hospital and admitted, and after many days in trauma intensive care, I was in a total of 47 days in the hospital. And nobody expected me to make it. I don't think that any of them did. Dr. Gogler told my wife after the first day, I've never seen anybody survive as terribly injured as your husband is. And I just give the honor to God for that. But I am here to honor the trauma team and all of you who go out and make the call. It was my great honor and pleasure to visit the emergency unit that ran the call on me, and the day I went out there, 2 or 3 of the men were there and just brightened their day and brightened mine, and many tears fell that day. But gentlemen and ladies, you are so important to what happens to people. What you're doing is a calling. It's not a job, and I know that you know that, because I know that you have to understand how incredibly injured people are, and you help guide them back to health. People look at me today and they say, "What? How did you go through all that? How? Well, the trauma team, the people that surround you, the therapist, it's all a huge team that make it happen. And I truly believe that I could have died immediately if not for the incredible response and the quick response of people and how they treated me at the trauma unit.
Yeah. Hello, my name is Bon DeLong, and I am here on behalf of my wife, who was in an accident on June 3rd, 2016. On that day, I got a phone call telling me about the accident, but not the severity of the accident, and for me to come in. And I was quite shocked when I got here and found out that the accident was in fact pretty severe. We were told that her first night would be the most critical, and chances weren't very good. And she came out of the initial surgery and began internal bleeding and had to go right back into surgery. And the doctor then told me, give her a kiss because this doesn't look good. Again, as a spouse, you never want to give your wife a kiss thinking that's the last time I'll see her. And through God, through the prayer, through the great surgical team, she came out of that surgery. She did survive that first night, and then we were told the second night would be critical, and then we heard that a lot. Every 24 hours was the most important 24 hours. She survived 74 days, and I give credit to her survival for 74 days really three ways. Number one, God is always going to get the credit. And then the other two were the surgical staff here and the entire staff, and my wife herself. Her strength, I can't imagine what it would be like to go through what she went through for 74 days, 30 major surgeries, countless procedures, sometimes even in the room, in her bed. The strain on her body, I just can't imagine. But for 74 days, I pretty much lived in the TICU unit in the room with her. And I saw firsthand the doctors, the nurses, the respiratory, the orderlies, everybody involved, the orthopedic people that cared for her bones. I saw everybody at work, and I saw them on their good days. I saw them on their really bad days, and they became family. I guess I became part of their family, and they became part of mine. And I got a firsthand glimpse that no one ever wants to get of how that unit runs on a day-to-day operation, including nights. I didn't sleep much, and I was here almost 24 hours a day. You know, if they'd let me be here, I was here. Sometimes I was here when they didn't let me be here. But 74 days is what we got, and then my wife passed away. And that doesn't sound like a very good ending to this story, and it's not, of course, because it affected our lives forever. But I still look back and thank God and thank the people here for giving us those 74 days. Because according to the surgeon, we weren't supposed to get that first night.
So what Trauma Day means to me personally is it's kind of it's a culmination of what we do every day, but every day we show up ready to face whatever we're supposed to do, whatever the day is going to bring us. And there's always sort of an anticipation. We have posters that are, hanging on the wall. Everyone knows this special day that we're going to celebrate our trauma survivors, and we're excited. We see people that have been coming back for a decade faithfully. We see people that maybe we just cared for months ago, maybe a year or two ago, and I just believe it re-energizes. It definitely re-energizes me to go back out and care for my team, to make sure that they have what they need to keep really doing what they do every day, which is delivering the best care. And it's so holistic, and you have to really be there to see it, but we care for every person that walks into our ICU. We're caring for, are they getting the rest that they need? Do they want to talk about anything? The nurses are caring for the physical and emotional needs of our patients, but it's a real honor, and it's humbling, and it's a gift, and I'm just thankful that I've been part of this team for so long, and I'm grateful.
What we bring to the table as a EMS helicopter is we bring the services of the emergency department and of that trauma center to the patient at the roadside. We have all the capabilities that the ERs have, and that's what we bring to the patient wherever they're at.
I'm Dr. John Canine, and I'm a physical medicine and rehabilitation specialist working at the Banish Institute for Advanced Rehabilitation Medicine. I also have a subspecialty in spinal cord injury medicine, and I've had the great opportunity to work here at Lakeland Regional Health since September of last year. Since starting, the thing that I find the most joy in working with these trauma patients is the opportunity to witness recovery in real time, to witness their functional return to the community, and really to witness the perseverance of each individual patient. These trauma patients have suffered an abrupt derailment from their normal lives, and oftentimes the return towards normal living can seem insurmountable. And that's one of the reasons I enjoy the day of discharge so much, because it's really a reflection of the perseverance and will of the patient and the teamwork of the patient, family, and hospital staff to attain those goals.
As far as encouraging trauma survivors, I would say keep going. Every day's a battle, but it's a battle that can be won. You've made it from probably seeing us in the ICU to being on our step-down trauma floor, maybe even being on a medical floor. You've made it out of the hospital into therapy. Like, you can make it, you can do it. Every day is a new day, and it just takes continual healing and continual support of the body and the mind, but it's possible and you can do it. You've made it this far, so keep going.
If I were to talk to a trauma survivor today, things that I would say to encourage them would be to put one foot in front of the other, take it day by day, lean on your family, and just know that the staff is here for you.
Oftentimes when patients come to our inpatient rehab unit, they question their ability to return home. They question their length of stay because it seems unattainable. They're dealing with new acute changes in their overall functional and clinical status. And what I remind every patient is that every day in the hospital is one day closer to home. And I think that's increasingly poignant in the era of COVID, because every day in the hospital is oftentimes a day away from family, especially earlier in the pandemic. So reminding them that every minute, every hour, every day in the hospital is one step closer to reuniting with family and friends is something that I like to encourage every patient with.
My name is Sue Kesley, and in January 6th of 17, I left my house to go get a pizza for supper. On my way, I went to call my son, who was getting married in a couple of days, and was coming to my house for me to fix his suit for the wedding. And I was going to call him to tell him I was going to get pizza. I noticed my phone was on the floor of the truck. So I was going down the road, and I said, oh, I can reach it. And I bent over and reached to grab the phone, and it slid, and the next thing I know, I hit the guardrail, and then the truck bounced back. And the next thing I remember was saying, oh God, not my new truck. And then I kept saying, oh, get me out of here, get me out of here. And there was a voice that said, we're gonna get you out, we're gonna get you out. And that's all I remember. The paramedics told me later, when I met them 6 months later, that I kept talking, and I don't remember. And the next thing I remember was waking up in the trauma unit, and my kids were there, and I said to my son, don't hold off the wedding because of me. And he said, Mom, that was 2.5 months ago. And I said, what? He said, Mom, you've been in a coma and you're in the tick unit. I don't remember things that happened to me while I was there, but my daughter kept a journal every single day, and she wrote down everything that happened. They made friends with the people in the trauma unit. The trauma unit works as a team, and they were there. They told them everything that was going on in detail. When things got tough, they were there for my family. They were a shoulder to cry on, whatever they needed at the time. I was, I think, 67 days in the trauma unit. They never, ever gave up on me. One of the doctors had said, she has a 20% chance of survival. And if she does survive, she's gonna be a vegetable.
They saved my life. I've got 7 grandkids. I have the opportunity to watch them grow, watch them to excel. And without the care I got, that first 9 days was touch and go. The doctors, when my wife asked, both of his daughters are out of state, and she was told, you better get him here as quick as he can because he might not make it.
I'm thankful and so honored to be able to speak to you guys, to everybody. I bless you, and I just continue to pray every day and thank the Lord for all that He's given me and all of the recovery I had and everything that is approaching back to normal in my life. It's a miracle. Thank you.
I hope they understand, but I'd say I love you guys. It's more than friendship, because I heard what you did for me when I was in a coma. I observed it firsthand when I came out. And then eventually I could talk and interact with them, and they never let up. They were extremely, they were fighting for my life.
Again, thank you for your knowledge and for your patience and for your dedication to saving your patients. Your absolute love of what you do really is what saves everybody, everybody on that floor.
Ditto.
I'm lucky to be alive, and I'm lucky to be here, and I'm living proof. I don't care what they say. I'm no vegetable, and you won't be either.
A survivor is someone who beats the odds.
Someone with great courage and strength.
A true inspiration.
Someone who perseveres in spite of setbacks.
Someone with great endurance to overcome difficulties and challenges.
One who emerges from an obstacle with grace, dignity, and strength.
Someone who never gives up, refusing to quit as resilience is the only option.
A survivor is you. Thank you for inspiring us all.